Welcome to People's Choice by Intermountain Healthcare. The second question that we're going to ask our contestants is, aside from your doctor, who is the person most important to have access to your health record? Dr. Wood.
It would be the caregiver that you've assigned in your family, a family member.
A family member. Survey says absolutely. You're right. So let's talk about this. We talked about it briefly before. Let's talk in a little more detail. What's appropriate? Who should have access? Certainly family makes sense. Let's see questions 2 and 3 before we really delve into this. Okay. Interesting that survey respondents said family before even themselves. That's curious. And also interesting that aside from your own personal physician, no other physicians made the list. People seemed reluctant to share their health record, their health information with others. No one is the third response. What do you think of that? Is it appropriate that no other physician has access?
I think it's very situational. So to me, it makes sense if you're asking someone on a hypothetical question who should have access, that they're going to be thinking, a very limited group of people should have access. But when, let's say you have a chronic health condition, like a diagnosis of cancer, now your circumstances have changed. And in that situation, I think most people say, yes, I'd like to have my primary care physician and my oncologist and my surgeon all seeing that same plan of care so that that care can be coordinated between the two of them and we don't have unnecessary testing or repeated imaging studies and other things that probably don't add value to my particular case.
Okay. Have patients, especially the two physicians we have here, have patients ever indicated a reluctance to you directly to share their record with others?
Usually when we talk about this, we're talking about mental health issues or substance abuse issues. But the bottom line is, and what Mark was talking about earlier, if I have sensitive issues about alcohol treatment program as an example, there might be physicians I really want that person to know about, but there are other people I don't want the general public to know about that. I'm working on that. It's an issue that I have that I want to keep quiet. So that kind of speaks to this needing to be able to offer security in different segments and situations. The other thing when I thought about family at the top is it's very cultural. In some cultures, the patient themselves are rarely the primary decision maker for their own health. It might be the mother or the grandmother in that family unit that really make the decisions, and so those are the people that need to have access in certain cultures. And sometimes we're not attuned to those needs, and we need to be asking about it.
Yeah, good comments. So, Marc Probst, let's hear from you about setting up the systems so that the appropriate people have access to records, but others do not.
Yeah, it's actually kind of a real challenge. If you think about the systems we built in healthcare, we built these systems to get the maximum number of people access to the information. Kind of the things Mark was talking about there are a lot of people involved in that care process. Particularly if you're an inpatient in a hospital, you're going to see lots of people. They're going to need access to that record. Now that we're changing our attitude about that, people don't want to share. We have to be very careful about setting up roles so that we know Mark's a pediatrician. If someone comes into the hospital and they're a 60-year-old male with a heart condition, pediatrician's not likely to require access to that information. Therefore, we can set up the systems to not have pediatricians or someone like Mark seeing that record. Flip it around, if it's a child, you can see the situation being different. We have built a lot into the systems to allow access to the right people, but make sure that the wrong people don't get updated. So it's changed a lot.
Craig, I would just add, going back to your original question, this really does need to be a consumer, patient, or health plan member driven decision. And we see the whole spectrum in practice, from people who are like, yeah, share whatever you need to share, to those who don't even want to sign up for the portal because they don't want their information to be too connected. It's very much a personal decision that each individual, each consumer should make for themselves.
Great comment.
And if I can offer a political statement in this.
Let's hear it.
Well, we've gone through a lot of argument in our country between opt-in, meaning we're going to take everyone, put them into the system and make it available, make the ability to have that record shared available. Or we have an option of opt-out, meaning you have to specifically say you want your information in the system. And I mean, just from a political perspective, I think it's up to the individual to decide whether they want that information shared.
Yeah.
And it's difficult because it takes a lot longer to get that information in and be able to have it move freely through the system. But this is sensitive information, and it's kind of, we have a sacred responsibility to keep it protected, and we can't if we just are willy-nilly about it.
Absolutely. Great discussion. Thank you, gentlemen.